So I've been practicing for about 4 years at MD Anderson in Houston. It's the University of Texas, and it's a cancer center. I work with an interdisciplinary team. We're very closely associated. So when we're on the inpatient rehabilitation unit, we have weekly meetings discussing every patient, medical issues, social issues. The case manager is there discussing insurance concerns. The nutritionist is there. We look at numerous nutritional factors, and we try to make sure that every team member is aware, including the speech, physical, and occupational therapists, so that they can emphasize that in their hour-long sessions with the patients. Carries over to the inpatient consultation team because there I also closely communicate with the therapist. We talk about goals. Sometimes the goals are getting the patient into the inpatient rehabilitation unit, but other times the goals are getting them home safely with their families, whether it be for further treatment or whether it be for palliative care. We talk about equipment needs, what we need to do, family training, car transfer training, all of those to kind of further their care. So oncologists are always looking at the data, the literature, and we're trying to slowly bring that to them and say, this is the impact that we make with rehabilitation for your cancer patients. I work pretty closely with oncologists. We communicate a lot about patients, their treatment plans, and then the impairments that have arisen. Value-based care is important. That's basically where healthcare is moving towards. And so it is really important that we show the value of rehabilitation. I think we're trying to continue to do that. So that's where the research comes in to show what the value add is, how we minimize costs, how we decrease length of stay after a stem cell transplant or after a pancreatic surgery, how we decrease post-op morbidity and mortality with interventions. And those interventions are not always prior to treatment, they're also during treatment. And the research is slowly starting to show that, but there is much, much more needed. So what gets me most excited is probably the opportunity to grow cancer rehabilitation. I feel like we're just at the beginning, and there are so many ways to integrate into cancer rehabilitation and really make an impact while providing value-based care to cancer patients, their families, and other providers. It could be oncologists, speech, physical, occupational therapists. Currently, it seems like that whole field is open and willing to grow, and there's just so many avenues to continue to pursue in the field. It's really exciting to go into an open area where everybody is looking to learn and is interested in what you have to offer.